The second segment of the show for today. We're talking to Dr. SWolff and Ms. Beverly Weatherspoon, who has given us some information relative to cancer care, diagnoses, and survivorship. And of course, I think we promised Ms. Weatherspoon that we would give you an opportunity to continue Dr. Wolff's discussion in reference to some of the problems that you have to deal with dealing with cancer. Let's start off, and then Dr. Wolff would join us later on.
Okay. So I mainly work in the breast center at Nashville General Hospital, and a lot of the patients that we see with a new diagnosis of breast cancer, the majority of them don't have a family history. Only 20% of our patients will have a family history of breast cancer. So it doesn't exclude the rest of the population that they're safe. So a lot of women and everyone, as far as cancer is concerned, it's not necessarily related to family history.
And so that's a very, very important consideration, you think, Dr. Wolff, in terms of the people that might be susceptible to this disease. Is that right?
Absolutely. Since we know that most patients don't really think they're going to get cancer, I think that means that everybody should practice a way to prevent themselves from getting cancer. And those are very easy things to do. And unfortunately, it's something that we don't do very often, especially in the state of Tennessee. And that would be very simple things. So the first thing is smoking.
Okay, smoking. Okay, and of course, this is what we generally talk about when we talk about risk that people face in terms of this disease. Would smoking be one of those things that you would put at the very, very top?
Smoking is the highest risk factor of most cancers. Virtually everybody who has lung cancer has smoked.
Speak to that.
It doesn't mean if you smoke you're going to get lung cancer, but that means if you smoke you're going to increase your chance so much that you're much more likely to develop lung cancer. Smoking also causes breast cancer, it causes pancreatic cancer, it causes colon cancer. I mean, I could be put out of business.
If people stop smoking.
Yes.
That's
and I would love to take down my shingle.
Okay, very good. But now you find, considering that, Dr. Wolff, why is it that the people who come to visit you and you tell them about smoking, they, for the most part, they don't pay any attention to that? I mean, not only you, but you know, who physicians might have time and time again indicated that this is one of the reasons for the first cause and high risk and et cetera. Why is it that people continue to smoke, understanding that?
So I think there's two reasons. One is people say, well, it's not going to happen to me, and I know plenty of people who have smoked and nothing bad has happened to them, and that's true, but if you do something that's risky, you may not get that event, but you're putting yourself at a much higher risk of getting that event, and that's what smoking does.
And folks find that very, very difficult to believe, don't want to, and they would rather smoke than to have a chance of reducing their risk at cancer.
And that's right, and I think the second reason is that it's sometimes difficult to smoke. And I think what makes it difficult is that if people in a social group don't give up smoking altogether, it's difficult as an individual if your friends, if your family, if your colleagues smoke. So if I could do anything, I would just say, please don't smoke.
What about you, Ms. Weatherspoon, in terms of some of these risk factors dealing with cancer? What do you tell your friends and other individuals, your patients, in reference to this?
Just overall lifestyle changes. Living a healthy life, having a good diet, getting your exercise, and going to your follow-up appointments with your doctor, getting an annual exam, all of your screening exams too. And that includes anything from your mammograms to your colonoscopies to your annual blood work that you may need. And so you have to really, in a real sense, I guess, Dr. Wolff, sort of take command of your own health if you wish to be healthy. Is that what we're saying?
Absolutely. So one, you reduce your risk, but even when you do that, you still have to what's called be surveyed for cancer. So you have to have screening tests. And the reason why that we do screening tests is that if we find a cancer with a routine screening test, most of the time it's going to be caught so early that the cure rate is so high, and that the therapy needed to treat an early cancer, usually it's much less difficult than to treat a cancer that's far in advanced.
So prevention it plays a very, very significant role in terms of preventing cancer as a disease.
Right, so first we prevent it, but even when we do that, you still may get it.
Okay.
We want to screen you for cancer development and screen you so we can find something so early that the treatment will be very easy. And actually, Beverly is very important in screening for women.
Why don't you say something about that, Ms. Weatherspoon?
Well, working in the breast health center, we see a lot of women coming in, not necessarily for a problem in the breast, but a lot of screenings. We do see women just on a yearly basis for their screening mammograms as well.
And I think that you talk about from diagnosis to survivorship. Now, what is the reaction, and perhaps maybe this is not something that you'd like to talk about here, but what is the reaction of individuals who happen to come to you and find out that they've been diagnosed with cancer? I mean, there's a general reaction, I think, and certainly it couldn't be anything that anybody would be pleased with. But is there any kind of remorse or what? I mean, what?
Well, fear and anxiety is some of the first feelings that these patients have, but just it's always good to have family members with them so they can get some of the information at the same time, because a lot of times the patient, they leave the clinic without remembering a lot of our recommendations, but we have an excellent support staff, and in our clinics we have excellent nurses, and it's just good to have the whole team involved. And that's the oncologists, the cancer doctors. Sometimes they need a surgery team, and then medical imaging. Just.
Well, what do you say, Dr. Wolff, in reference to some of your patients, for example, who might find out that they've got cancer? I mean, what is your response?
So the saddest patient that I see is somebody who's went through screening, gets found early, but then denies the illness. So I think denial is very important. And what that means is that sometimes the cancer has a chance to grow, to enlarge, and to spread. So it's just like screening. If you deny yourself screening, then you deny yourself the early chance of getting cancer, caught at a very early stage. And if you have cancer, if you deny the need for therapy, then you're going to maybe lower your likelihood of being cured. The issue is not whether we can cure patients. We can cure virtually every patient with cancer nowadays, especially if it's caught at an early stage.
But the whole thing is whether or not they themselves wish to be cured of cancer. Is that what you're saying in a real sense?
I think that happens to a lot of patients, and not just.
And let me interrupt here again for this final commercial break. Dr. Wolff, we'll be back with our audience following this very, very short break.